And most often, if we are discussing and we don't have these key personnel to hear for themselves, plan for themselves, and also advocate and engage them positively, definitely we'll always have a gap. I remember there was this time that we were challenged that health workers doesn't want to stay in the community. And I now took myself, for instance, if I'm married, having children, and my husband is living in the city, and I'm posted to the remote area, and you are expecting me to stay there, are you sure that when I come back after 6 months, my husband will still be single? Will he still be single? He will not. He will not. So definitely we have to plan alongside with them. Thank you.
Thank you very much. So that question, were you expecting a response? Are you expecting a response from any of them? Okay, primary healthcare. Let me hand over the microphone.
Okay.
I'm also going to talk.
We should take all the questions first. Okay, the last. Thank you.
Thank you so much for this opportunity. My name is Chungyang Yakubu Bagins. Let me speak on the platform of the civil society. I was complaining that how comes that this very important discussion, nobody was brought in from the sect of the civil society to hear our voice concerning what is happening on the health issues in the state, because we cover everything nook and cranny. However, I really appreciate what has been said by the various presenters. I am privileged that by nature of my work, I have interacted with many of them, especially under the primary healthcare where I volunteer at the moment. We really appreciate, just as before I come to my main question, as Dr. Jerusha did say and other discussants did say, concerning the postings of staff to the facilities, and as the CMD did say also, there are so many facilities that don't have staff, and unfortunately the recent employment that was done by the state, I think we were expecting that they will employ a larger number of people, but the number of people that were employed cannot meet the needs of the people in the facilities. And one of the biggest problems that we're having is, just as she did say, your husband is in Jos and you're posted to a rural area. If you stay there for too long, something may happen. You come and meet a co-wife or something like that. One particular issue that happens is we have had people who have worked as volunteers in clinics in those rural areas, and many of them are from those communities. Unfortunately, when the last recruitment exercise was done, most of those who have worked as volunteers, some 10 years, some 15, some even 16 or 17 years, unfortunately, they were not engaged. And people who have not worked or people who do not have experience were engaged. They were brought in, their husbands are working in jobs. Some will come and report and say, we'll work for 2 days and go. While people who are volunteers in those communities are from that area, they have been sacrificing, we are not given the employment. So I think that needs to be addressed as a serious issue. The last issue I want to raise is I'm a member of the Cancer Network. I'm also a member of the Nigeria Cancer Society. Currently, we have rising cases of cancer, and we have so many people that are really in pains because they have been diagnosed positive with cancer. The treatment is so expensive. I didn't hear Plus Chairman mention anything about cancer, though they talk about HIV, which is also one of my areas of specialty. What can we do as a state, as stakeholders, to support, to alleviate the problem of people who have been diagnosed with cancer, because the treatment and care is very, very expensive and quite enormous. I did mention one day during a radio program or during the World Cancer Day that in Borno State,
you should be rounding up. Yeah,
I'm rounding up. That the governor gives every quarter, he gives about 250 million to the teaching hospital. And I did suggest that day that if Jude, which is the central, which is the northwest, north central cancer treatment center, if our governor can also, people of government are here, if our governor can also inject some capital into the treatment center, apart from advocating to philanthropists who are people of Plateau State, like Aliko Dangote did for the people of Kano, for their cancer center, he injected a lot and lot and lot. So I want to plead that if that can be done for us, it's going to be preferable. Thank you so much.
Thank you. So I'm going to quickly do these two things together while I give my very wonderful panelists opportunity to give us their parting words. Seconds. So
Thank you. I want to agree perfectly with the suggestion of the CMD, a senior colleague, and to point out the fact that the National Primary Care Development Agency, in collaboration with the State Primary Healthcare Board, designed a program called the Community-Based Healthcare Workers. The initiative was for us to employ people from their ward. So the strategy was for us to employ at least 10 persons from every ward. If you cannot get a healthcare worker in that ward, you employ a secondarian. And there are strategies for transitioning them or training them. When you employ them, you take them to School of Health so that they will come and be resident and be working in their communities. The challenge that we have is the National Primary Care Development Agency also wants to see a commitment of payment or takeover payment from the state government. And that is what we've been trying to get from His Excellency, which I know he is going to do that based on his open political will. So based on posting, I'm going to speak not as the executive secretary, but as a technocrat, because
30 seconds.
the challenges of the posting was even more difficult than the employment, because political interference kept coming and you cannot even contend with it. Then I'm also going to talk about policy. We talk about integration. There is one major hindrance in Plateau State that is making our integration and giving success to service delivery a problem, which is the non-implementation of primary health care under one roof. We have written to the governor, he approved it, but it's awaiting deliberation and ratification at the State Executive Council meeting. In that light, the primary healthcare board is supposed to take over the payment of all staff so that they can be responsible for their
very much.
plan. Just to say that
Thank you.
the primary healthcare system in Plateau State, right as it is now, has more challenges than achievement. So we urge all stakeholders to put hand on deck with us so that we can surmount some of
Round
these
of
problems.
applause for him. Thank you. So can you just pass it to your parting comment and if there are any questions to you?
Okay, thank you very much. And fine deliberation and contributions. I actually just want to make comment on the question that was asked by you about partners collaborating with the states. I mean, partners don't just come and do what they like in the state. There is a coordinating arrangement in the state. I mean, the swap DEX is actually coordinating partners across the state. And then before the swap arrangement, we have what we'll call the State Partners Forum meeting, and this holds every quarter. And then partners come together and align their activities together. And then I think from the Ministry of Health, the DPRS, that is the Director of Planning Research and Statistics, have mandated every partner on a quarterly basis to submit its work plan and budget to the State Ministry of Health, and of course, Plateau State Agency for the Control of AIDS, and of course, in the State Aid Program Coordinator. this APIN have consistently, I don't know if, I mean, if the Honorable Commissioner is here, he will attest to the fact that APIN has consistently submitted such, and then we align our activities with the State Ministry of Health.
Thank you very much. Thank you for complying. Professor Shingle.
Thank you very much. Before we started, I was wondering if 1 hour is not too much, but I can see that we spent over an hour. And yeah, so for us, as a Department of Community Medicine, which is a stakeholder in this engagement, we are supporting the Primary Healthcare Board through collaboration with some PHCs, where we send our doctors to assist because of the shortage of manpower. Recently, we did a community diagnosis at PHC Miadiko. We spent about 8 months there with the approval of the Honorable Chairman of Jos South Local Government. So we are doing a lot too in our little way within the state. We encourage every partner to and government generally to always collaborate with us. We are, you know, the theme for the World Health is just about science, evidence-based. And we can cooperate with you, we can work together with you to generate evidence in almost everything. The world now is talking about implementation science, and every hand should be on deck so that we can do all this research together and generate evidence that will guide policy decisions.
Thank you.
very much.
Thank you.
Okay, thank you. CMD, sir, thank you. This is the third time I'm hearing you say this, and I'm very proud to tell you that we have 5 products that are being produced in the name of the agency. We have a suspension antacid, we have a cough syrup, and then we have 3 other products for external use. I wouldn't want to say the 4th time anywhere without having the additional standard information for you. Again, just to respond to the woman, our mommy there who raised a concern about participation of the community. The primary healthcare, the DME and Plastema actually exist as a set of triplets, and we have a critical stakeholder that basically refers to the community, the traditional rulers and religious leaders. And I'll tell you, we've been working hand in hand with them, and why you are here is to basically help us disseminate the same information to them. Please clap for yourself. In closing, I want to say that I have considered
Before
the
you
situation.
close, next time we'll bring them here.
Thank you, ma. All right. So I want to say that if what is actually a prescription or the strength of a prescription of a physician when the set quantity of the medication doesn't get to the patient, what then is the strength of a pharmacist when you assume that this particular product is finished but truly is not finished? What then is the hope of the patient that he or she takes that medication and doesn't get to the end? So I put myself in that position and see myself as someone who desires the need that that medication acts instantaneously or as described in what it takes for that medication to function. We are not going to let you down by the grace of God.
Amen. Thank you. Finally, DG plus chairman.
All right. Thank you very much, the Chief Medical Director of the Jos University Teaching Hospital. Thank you very much for the encouragement. You've always been doing that, and I'm sure you will not rest until we achieve our mandate here in Plateau State. So again, I'd like to say that the attainment of universal health coverage is actually a moving target. And as such, there's no nation and there's no people on the face of the earth that have achieved 100% universal health coverage. But we continue to design our programs and modulate it in such a way that it will fit our context. And you've given us very viable suggestions about the use of community development associations. I'd like to tell you that Plastema works very, very closely with the Community Development Association. As a matter of fact, we have had robust engagements with the Plateau Initiative for the Development and Advancement of the Natives, that's PDAN, and we have co-designed programs with them to see how we can deliver on the attainment of universal health coverage in Plateau State. Now, the tool I talked about the design of a CBHI specific to Plateau State that is relevant to our context, we had representation of PDAN, you know, in that regard. You talked about the use of in-kind premium for the purchase of health insurance. Now, I'd like to, it will interest you to note
that when we went out to collect this data for CBHI, one of the questions that we asked was whether people were willing to contribute, whether goats, or farm crops, for as premium. But unfortunately, well, relevant to Plateau State, they preferred paying money instead of those tools. So we've gathered the data, and we are going to implement it and see how the tool, as analyzed, is going to behave within the system. And thereafter, we're going to also call stakeholders together and further fine-tune it to become a tool for advocacy as well as programming. There is a question about how to alleviate the pains and suffering of people with cancer. Now, for every program design, as it affects social health insurance, what is very critical is the pool of funds available. So whatever, if you look at the WHO cube for the design of, for monitoring how a people achieve universal health coverage, there are 3 dimensions. The first is the number of people covered. The next is the services that are covered. The third is the proportion of out-of-pocket that people will have to pay when they go to access care. But central to all these is the pools, the full funds that have been pooled. So I'd assure you that at the moment, we're not ripe to begin to include the treatment of cancer and some other care that are excluded within our benefit package. But as we continue to grow, as we continue to expand our pool, you can be rest assured that things that are at the moment excluded will definitely become included. In conclusion, I'd like to assure you that at the agency, we will not rest on our oars until the last man that resides in the last mile of Plateau State is covered with Class Cheba. Thank you.
Thank you very much. Thank you very much. So thank you to this wonderful audience. I have tried to summarize a few things that I think are key, not everything. So as we conclude, it is clear that achieving universal health coverage in Plateau State is not beyond reach from all that we have heard today. But it requires deliberate alignment of efforts. So from this discussion, we've underscored, one, that the importance of strong primary healthcare system, particularly human resource, and the intentional training and engagement of human resources at the grassroots in achieving universal health coverage. Number 2, the need for financial protection through effective insurance coverage, the engagement of community development committees, and the right-based approach to demand creation at the community level. This is quite needed for us to move from where we are in universal health coverage. Thirdly, that there's a critical role, the critical role of reliable access to quality medicines and commodities, and the security of the drugs and commodities is at the top burner, and we must ensure that this is sustainable. Lastly, the value of technical support, partnerships, and evidence-driven decision-making from data and research is what came out from this discussion. However, real progress will depend on stronger coordination. I know a lot is already going on, but from our discussion today, we'll need stronger coordination. We need a shared accountability, a sustainable system or systems, and a collective commitment to leaving no one behind. That I saw from the t-shirts. So if we can move from fragmented efforts to coordinated action, I think the professor mentioned that, then universal health coverage in Plateau State will not remain an aspiration. It will become a reality for every citizen. So at this point, I want to truly, deeply appreciate my distinguished panelists, the wonderful audience, for this exciting and very, very rich conversation. Thank you very much. And then I take my leave.
Thank you. Please, before you take your leave, would like you to leave us with a photograph. if you don't mind. Please, if you can all stand up, our panelists just in front here. Definitely, definitely. So, they've done a very good job. Make sure you give them a good photograph. Thank you. Are we good?
Yes, please. Yes.
Please, thank you. The LOC chairperson, Professor Banwatma. Keynote speaker, Dr. Ajik Magaji. Is it good? Photographer, we good? Thank you very much. Please, a round of applause for them once again. Thank you so much. Thank you very much. It's been an awesome time being here today. Wonderful discussions and deliberations. Thank you so much. Thank you. And please, a round of applause for our anchor. Please, you can do better than that. At some point, I felt we should hand over the mic to you to end the program.
To finish off, ma.
Thank you very much, Ma, for doing an awesome job. At this juncture, we're bringing this program to a close. We sincerely want to appreciate all of you. It's not our official duty to do so, so we'll get the chairman of APHPN to give us the closing remarks, and then the chairman of the organizing committee for this great event will also come to give us her vote of thanks. Before we do that, we'd like to recognize a few people very quickly. We have here representing the CMD of the Plateau State Hospital Management Board, Satdom Danladi RD, the DNS PSHMB. Where are you? Please, a round of applause for him. Thank you. You're welcome, sir.
You're welcome, sir.
We also have here the State Project Manager of Malaria Consortium. We called him earlier on. He is around, no other person but Dr. Masho Mbwas.
You're welcome, sir.
You're welcome, sir.
Welcome, sir.
Thank you for joining us today.
You're welcome, sir. We also have Professor Ocha Baji of the Department of Medicine, an erudite professor of medicine from the University University Teaching Hospital and the University of Jos. You're welcome, sir. Highly welcome, Prof.
And finally, for this time, I know someone have walked in, but then let me just recognize also the president of the Jos University Medical Students Association, JUMSA, Christopher Dakat. You're welcome, sir. Thank you very much. And all medical students around, thank you so much for coming. I want to also recognize our ushers for doing an awesome. Ushers, can you wave, please? Can you wave? Thank you very much. You are seen. We see what you're doing. At this juncture, Phil,
yes,
what do you think?
Would be calling up our professor, the chairman of APHPN, to give us the closing remarks at it? Yes.
Closing remarks.
Yes.
Closing
You're
remarks.
welcome.
Yes, Prof. This is a round of applause for Professor
Whether it is time for her to come up or
Asabe
not.
Minor. She is also the chairman of the APHPN. You're welcome, ma.
The Honorable Commissioner of Health, who unfortunately had to leave because he was called in Government House, but we know that he was with us throughout the time we were here. The chairman of the occasion, who has been ably represented. Our guest of honor, the CMD of Youth and my boss. He is also one-time chairman of APHPN. Our keynote speaker,
Dr. Magaji Izang, sorry. We recognize, I really enjoyed your presentation. Thank you so much for the time you must have invested in putting that together. Our panelists, what an awesome job. But I do have to mention our co-collaborator, DG of Plaskema, who was among the panelists. They really love you. Every time your name is mentioned, your name comes or your staff start clapping. But I have to mention you among the panelists. And of course, my brother, pharmacist Kimbot. We've worked so much together. And we never knew where time was going to take us. Then we were just working for free. And today we are here. It's not that I don't recognize the other panelists. I just had to point out these two. Thank you so much. I thank you so much for the panelists who, I'm not supposed to do a vote of thanks, but I'm actually still trying to establish the protocol here. The heads of agencies that are here, quite a number are here. Many of them were called. I think Dr. Kwande did a good job in calling out the protocol. But the heads of agencies, heads of development partners, who are here, so many of them, CMDs that have come, directors of the medical, of the State Ministry of Health, heads of associations. I don't want to call them because time has really gone. And of course, the members of all these associations and agencies that are present with us, members of APHPN and Plaskema, and also the members of the media who have been with us since 7 o'clock in the morning. I'm supposed to give the closing remark, but I'll start with a little story. So, a couple met in the name of APHPN and Plaskema and decided that they want to do a marriage. And when this marriage, they started their planning quite all right, you know, in the little effort that they could do. Then suddenly the parents realized that these people, well, we've watched them, but let's see what we can do. So our parents, WHO and the State Ministry of Health, led by the Honorable Commissioner, decided to escort us to the final day. And they did that by bringing in more people, bringing in more partners, inviting more, because you know, you can't have a wedding without people to watch and participate. And today we see the culmination of that marriage ceremony that was being planned for. And clearly today, I believe that something has been achieved. And what we have done here today is to show the value of actually working together. And we are hoping that with what has been outlined today, that we have seen an urgent need for stronger collaboration, for evidence-based decision-making, and for sustained investment in public health systems. I am very particularly pleased by the actionable recommendations that were made at the end by both the keynote speaker and the anchor for the panel. And we are hoping that as APHPN, we will be able to remain committed to working with all our stakeholders to translate these deliberations into measurable actions. So today a marriage has been done, and we hope that going forward, the conversations that we have had in this hall will not end here. Let us take them back to our institutions, our communities, our spheres of influence, and collectively drive the changes that we desire to see in our health system here on the Plateau. So on behalf of the Plateau State Branch of the Association of Public Health Physicians, I express my profound gratitude to the organizing committee, our partners, and everybody who actively participated and gave and contributed to the success of this event. Your dedication and professionalism are deeply appreciated. As we leave this place, I pray that each and every one of you gets to your destination safely, and that we look forward to a continued collaboration as we work together to a healthier Plateau State and a healthier Nigeria. Thank you and God bless.
Thank you very much, the Chairman, APHPN. Thank you so much, Ma. Please keep clapping until she sits down. That is the host of this meeting.
Thank you so much, Ma, for that speech. All right, so finally, by the way, if I didn't get anything, there's a marriage. So if I walk into your office, you know that there was a marriage. I am the child. We are the children. All right, the chairman of the local organizing committee of this great event, Professor Matilda Bamwat. Everything was made possible with her organization, her direction, her... You're welcome, ma.
If I stand here, will you see me? My work has been made very easy by my chairman. But I want to start by thanking you for being here till this time. I wish I could go around and thank you each. So please, on my behalf, shake the person on your left and right. Tell the person, Professor Bawak said thank you. In your language. In Mogavul, the language we are speaking in heaven. Thank you. We're very grateful. Thank you for coming. Thank you for staying. Thank you very much. I'd like to especially thank the Honorable Commissioner of Health, who was with us from the beginning up till a few minutes ago that he had to leave, and as well as the staff of the of the State Ministry of Health. If you're still here, Minister of Health, thank you very much. Thank you. WHO, the state coordinator, ably represented, as well as WHO staff. Are you still here? Thank you. Thank you very much. My CMD and younger brother, Dr. Poko Bubwada, and all staff of Youth. There were some staff around. Staff of Youth, thank you very much. Want to specially thank the state coordinator of National Primary Healthcare Development Agency. He just reminded me that he's one of my children, so I'm a proud mother. Thank you very much. And all the staff of primary healthcare, state primary healthcare, thank you. We're very grateful. Thank you for coming. Dr. Solomon Kwande, we're so grateful for this wonderful marriage. And all the Plaschema staff from morning till now. Unado, thank you. So Dr. Raymond Jurit, ably represented, and all the other staff, thank you very much. Pharmacist Kimbot, thank you for the energy and the drive. And I know you love we academicians, we know. Thank you very much. Thank you. We're grateful for APIN, ably represented, as well as Professor Agbaji. We're so grateful. Thank you. Thank you to the academia and APHPN members. Are you here? Thank you. We're very grateful. Our donors, site savers, HANS, the Ministry of Health, CHAN, and so many others, the Malaria Consortium, thank you. We're very, very grateful. Can we have a hand for them too? Thank you very much. The media, thank you very much. And the music, the DJ, right? Thank you very much. I want to truly, truly appreciate everybody. This program would have been useless if all of us were not here to enjoy it. Thank you too for many others that I can't mention by name. Our students, our ushers, many of us. We're so grateful. We trust that if ever we call again, you will come. Do I have your commitment that we can come again? So we trust that this marriage, what World Health Day has put together, let no man put asunder. I wish you a very safe journey back to your homes and have a lovely evening. Thank you.
Thank you very much, Prof. Ma. Okay. These are one of the moments I love. Everybody's looking. What does he want to say?